Hey everyone, welcome back to another episode of the Brawn Body Health and Fitness Podcast. I'm so excited that you're joining us today. Today I'm joined by Dr. Kyle Bowling, and we're going to be discussing the CTM Band. Now you might remember the name Dr. Kyle Bowling because he was actually a guest on the podcast about 2 years ago where we discussed something similar. However, a lot can change in 2 years, and in 2 years' time, Dr. Bowling has developed a overwhelming amount of new evidence to support the CTM band, including the incorporation of musculoskeletal ultrasound to show its effect. That's right, there's literally pictures that show that using the band makes a difference on the muscles. This is something that I've been using in clinical practice for quite some time, and I highly recommend it. Now, I don't just recommend it. I'm actually very excited to announce that the company that I'm partnered with, Tire Physical Therapy and Performance, based out of Millsboro, Delaware, Berlin, Maryland, and Fruitland, Maryland, right near Salisbury, is actually partnering with CTM Band, and we are going to be the first ever retail provider of the CTM Band products, period. So if you're interested in coming into the clinic, giving these products a try, or ordering a set of bands for you, your team, or whatever, please feel free to reach out because we are super excited to incorporate these into our daily practice and use them to help more people. I highly recommend the product, and I don't just say that. I've actually owned one and used one for about 4 years now. So I know you're going to love this episode as we dive into a bit of nerdy science and a bit of application for the CTM band. Kyle, welcome back to the podcast. I think it's been almost 2 years since we last talked. It's exciting to catch up with you today.
Yeah, likewise. Thanks for having me. I've lost all concept of time with COVID, so you could have convinced me it was 7 years ago, I think.
Yeah,
As
no,
it's only two.
I can relate with you there. For people who haven't, seen those podcast episodes we did previously, or maybe they haven't heard of CTM Band before, would you mind kind of filling them in a little bit about, your company, who you are, and what all you do?
Yeah, so by trade, I'm a sports chiropractor, and I'm based in Louisville, Kentucky, and I own and operate Kentucky Sports Clinic. And I created the CTM band. It's basically a functional myofascial release tool that you would use in the same way you would with like a foam roller or stick roller, massage gun, any of the things we use in that realm for recovery. And it kind of came from the combination of listening to what my patients were telling me that were, for instance, if someone was coming in and they were having some calf pain and they mentioned they were foam rolling but couldn't quite get to the spot that felt like was tight and not working the way it should. Kind of combining that with my own background as a competitive distance runner and a former Division I athlete. So I kind of pieced the two things together and started developing this tool.
Yeah, that's awesome. And I would say that it's been wildly successful because I feel like I'm always seeing something on social media of, this person's using it now, this person's using it now. I've used it with patients in the clinic. I definitely bias it a little bit more towards the endurance population because I know that's your background yourself. But I've used it with a variety of other patients as well. Even pickleball players. I've had to learn what pickleball is.
Oh yeah.
They love it. So it's certainly a really cool tool. And I think it really does a great job of solving one of the pitfalls of manual therapy or any kind of hands-on technique. And that's the passive element to it. With the CTM band, you're able to address that by using a more dynamic, active approach to your, rehab or injury prevention or mobility work or whatever you're addressing. And I think that the more active you can make things, the better your result is going to be at the end of the day.
Yeah, absolutely. And that's a big part of what we're going for with the band is making it a truly functional type of myofascial release device. If it's a runner who's having a mobility issue with ankle dorsiflexion coming from the soleus or calf, you can put the band on and start retraining ankle dorsiflexion, as opposed to if you're trying to use a foam roller or a massage gun where you're just kind of digging in or gliding over the surface of the skin, which still, there's still some value to it, but it's not going to really restore the sliding surface mechanism that the tissue needs. Kind of the same thing with, say it's a pickleball player or tennis player, if they're dealing with some, lateral epicondylitis or something similar when they're going through a swing, you can really help retrain that movement if it's coming from a mobility issue in that area.
Yeah, definitely. I love it. Now you mentioned it's called the CTM band, the compression, tension, movement band, and then you just mentioned about the sliding mechanism. So is there something about the combination of compression while tensing and actively moving that helps to restore the sliding mechanism for optimal muscular movement during a motion? Or kind of walk me through some of the theory here a little bit, if you don't mind.
Yeah, absolutely. So that goes back to what kind of got the hamster in my head running on the wheel was, for instance, a patient telling me they couldn't get their calf feeling better. So that kind of led me down the rabbit hole of reading about studies that have been done on, whether foam rolling or something similar really does cause, a measurable and functional change in the tissue. And so, what I could find on, PubMed diving into it was that the studies that were successful with using a myofascial release device was that you had to really pair three things simultaneously, which was the ability of a tool to compress tissue, dig in and kind of grab that tissue, and then cause a shearing between the layers of tissue using movement. And there's been a couple studies that have been done that show that sliding surface mechanism. The two I always talk about was one was Guillaume Berthaud did a study showing, I think it was in the hand. He's a hand surgeon. That there's a sliding surface mechanism between the layers of tissue that control the function of the hand. And the one that I think is maybe a little bit more valuable was Sarah Condino did a study on Achilles tendinopathy that showed as an Achilles was getting close to tearing or rupturing, there was a decrease in the sliding surface mechanism that was observed via musculoskeletal ultrasound. And that's one that I think really holds some clinical value, because you think about, someone who's dealing with chronic Achilles tendinopathy or Achilles pain that, they continue to train through and eventually it tears. If there's a way to really monitor that and measure it, that's going to be really, really valuable from a clinical standpoint. So what the band does is really combines those three things into one and attempts to restore those mechanisms.
And there's not really anything else that comes to mind for me anyways that hits all three of those the way the band would. I mean, I can think of things that could compress tissue, and I can think of things that can add tension to a tissue, but I can't think of a whole lot that do both of them while allowing for free movement as you normally would through even functional positions like a lunge.
Yeah, and that's kind of goes back to when I was designing it and trying out different prototypes. Was I have a giant toolbox of things I use for myself as a runner to try to prevent injuries, and obviously stuff I use with patients. But when you kind of go through the list, a typical floss band is really cool. That's going to compress and move tissue, but it doesn't have the ability to dig in and grab and cause that shearing effect. A foam roller is going to compress the tissue some and dig into it, but you can't really get into a functional movement pattern with it. So I think it's possible, but it's just very difficult. So the goal was to create a very inexpensive, simple way to do that. And that's kind of where the band comes from, especially when you look at, some of these massage guns are on sale for $500 and you're like, and not to knock them, but to truly do what these studies are saying, it'd be very difficult to do with a massage gun.
Well, once again, the massage gun is very passive in nature. And in general, I try to limit the amount of passive time I spend treating a patient. I think in general, the more active you can make a session, the better they're going to get. Now, obviously, there's a limit to that, like if someone's post-op or whatever. But just in general, your normal knee pain, ankle pain, hip pain, that kind of stuff, I think activity is definitely essential. Now, you
Yeah.
mentioned a few times that you have a background in running. You've kind of developed this for the runner originally. And one of the first things that's come to mind for me with runners, and where I've used it myself actually on some of my patients, is that plantar fasciitis type thing. And I'm talking a true plantar fasciitis type presentation. So for those listening, maybe they have plantar fascia. Well, let me rephrase that. I hope they have plantar fascia.
Yeah.
Maybe they're having
Hopefully.
some plantar fascia type irritation and symptoms. How would they go about modifying the band, using the band to address that? And what kind of exercise or movement type things should they be doing with the band?
The band, it comes with basically four holes on the end of it that has the ability to attach four knobs that can create that shearing tension we're talking about. So for a smaller muscle group like plantar fascia, you typically would use one knob and really position it into that attachment point where the tissue becomes thickened and irritated, right below the calcaneus there. And then, the plantar fascia is a big one because some of the newer studies on chronic plantar fasciitis are actually showing that it's more of a fasciosis, where it's not inflamed tissue. It's actually, it starts to degenerate and become brittle and lose oxygen and blood flow. So after a plantar fasciitis moves from its acute phase into its chronic, something like the CTM band or something similar that's going to dig in there and really beat the tissue up and cause that change of the thickened tissue to stimulate blood flow and oxygen. I've had a lot of luck with. But on the flip side, if you took the band and dug it into a fresh plantar fasciitis that's acute and truly is inflamed and irritated, it's not going to work well. So I think a lot of it depends on the correct diagnosis and identifying what phase it's in.
That goes into the whole argument of like tissue healing times and repair process, because I would say I haven't used it on the chronic ones, but I wouldn't say they were acute either. It's kind of in that subacute phase. People who've had symptoms for a couple months and they want to get it addressed. So I would say that might even be I don't have any research to reference on that, but I would say that'd probably be an area where it could shine as well. Now, when you put the band around the foot and it's digging in there, is there any specific movement or stretch or anything like that that you're looking for to the plantar fascia, or is it just kind of like put it on and move around as you normally would?
You definitely would want to go through a progression that moves from passive to active. So like say it's day one where you're not going to have a lot of tissue tolerance. It might be a little bit more sensitive to the touch. You might just put the band on and do some ankle circles or write the ABCs or just kind of go through plantar flexion, dorsiflexion just to kind of get the tissue moving. But then, what people will notice is the more they use it, the more tissue tolerance they'll develop to where what hurt really bad on day one then doesn't hurt at all on, day 5 or 6. So that's where you get up and, go through some heel walks, toe walks. You can even work into like a wall assisted calf stretch or eccentric heel drops. So you're really building the tissue tolerance and pushing it a little bit more as the days go on.
Yeah, I love that. I love that a lot. And it's funny you mentioned that because when I was in college and I'd first gotten your band, that was actually my go-to like leg day, like, pre-workout mobility type thing. And so I would take your band and I'd put it around. I actually went with the calf. We'll get
Mm-hmm.
into that in a minute. And I did heel toe walks just up and down like 3 times each.
Mm-hmm.
And I loved it. It was incredible how effective that was. And it was kind of simple, honestly. It was like, okay, wrap the band, do this, good to go.
Yeah.
So kind of working our way up to the calf there, has there been any specific diagnosis at the calf? Do you kind of use it more for like a tendonitis type thing or a shin splint type thing? Or what do you tend to look at in the lower leg with the CTM band? Where would you kind of see that
Well,
applying?
yeah, and I mean one thing I just remembered about plantar fascia is I've used it a lot in place of trying to do like ART type
Mhm.
movements in from a clinical standpoint, and there's been a lot of practitioners start using it in the last year or two, just to kind of help facilitate their manual therapy and save their hands a little bit, and
I
that's
like
one
that.
where you can really position one of the knobs based on patient feedback, like where you can say, all right, where this knob is digging in, is that where you feel symptoms? And they can say, yeah, or no, move it to the right or left a little bit. And then you can kind of use it, taking the toes through flexion, extension while you're pressing into the band with it digging. Some of those spots they can wear your hands down pretty fast, especially if you're trying to see a lot of people in a short amount of time. So it can really serve as a way to save your hands and combine a couple different manual therapies into one, as far as stretching or doing a pin and stretch or active massage. So I use it with I'm a team chiropractor for the University of Kentucky track team, and so we have like 90 kids on the team. So if I'm going in and working on athletes one day, I might see 20 or 30 people. So you're needing to really keep your body fresh as best you can.
So you're an entrepreneur with your own clinic. You started the CTM Band company, and you're doing stuff for University of Kentucky. When do you sleep, Kyle? My goodness.
The 3 kids are actually what probably wears me down the most. That's why I had to reschedule this podcast. That's the other stuff's piece of cake compared to the kid thing.
For sure. Now, where would you kind of look to choose the CTM Band over something like a manipulation type technique, especially like the calaperal joint or subtalar joint or one of those other foot ankle joint type areas there? When would you pick CTM over like something more joint targeted?
Really depends on the presentation of it. If you can rule out a tear or a stress fracture, and you're just looking for a modality to keep them moving, it's definitely in that arsenal of things to try to see how they respond to it.
So yeah, taking that band and kind of working our way up to the ankle joint now. Is there anything specific that would jump out to you as like, hey, I'll use the CTM Band here for ankle, lower leg type stuff? Like, do you look more tendonitis? Do you look more medial tibial stress syndrome? And what kind of stuff would you use the band with as far as like exercises for those things go?
Yeah, so that's a great question. For instance, let's say we're someone's having some posterior tib pain, whether it's a little bit further up where you get a shin splint, or down along the outside of the ankle there. So I think it starts with the clinician really doing an accurate assessment, because sometimes you could get a posterior tib that's acting up from plantar fascia being tight, or a soleus that's tight, pulling on the posterior tib. Those would be prime time examples to use the CTM Band, because it is used for to help with more of a mobility issue. But if the posterior tib pain is coming from an ankle that's pronating, or if the foot intrinsic muscles are unstable, or if it's further up in the kinetic chain where VMO or glute isn't firing, you could do something for mobility like CTM Band or stretching or digging with a foam roller or whatever, but it's not truly going to fix that underlying cause. So that's a long-winded answer to your question, but the key is the assessment first, and then differentiating. All right, does this have more of a mobility correction versus a stability correction, or is it a little bit of both?
Yeah, I think that's the right way to approach it. Is at the end of the day, you really need to know what you're treating, and that's why I think it's essential that a product like this kind of finds its way into the clinician's hands, where they can accurately assess and then determine how they're best going to incorporate it there. Say you get someone though with that kind of fibularis tendonitis type presentation. I had a patient not too long ago who came in with that as a script, and after I assessed, I actually agreed with it, which doesn't always happen, believe it or not.
Yeah.
But I ended up leveraging a lot of CTM Band type stuff with him to help address that. So I'm curious from your standpoint, if you get someone with that fibularis diagnosis, what kind of stuff are you looking at there with the CTM Band?
That would be kind of like the same type of deal with the plantar fascia, where it's a very sensitive area. So you want to start very, very light, maybe with just some easy range of motion, plantar flexion, dorsiflexion type movements with the band on, but then work into where, they're doing heel raises off the ground, toe walks, heel walks, or if it's one of those deals where, they have the result of the pain is decreased ankle dorsiflexion, going through some range of motion exercises to help improve that.
Yeah, definitely. And I would say too, I kind of like the combination of having the CTM band over top of the muscle bellies in this case. I know it's a tendonitis type thing, but I actually started to work up above the chain. He had a gnarly trigger point actually just distal to his fibular head. And we were actually crushing a lot of ankle strengthening with the band on. Now, I know that the band itself is going to be more of a mobility type tool, I'll say, but what is mobility without stability? And if I can get, an active release on a trigger point specifically while strengthening the muscle at the same time, it actually was quite effective. And again, I don't really have a whole lot of, research or a, overwhelming amount of studies to go on for that. But in this specific case, it worked really well for him.
Yeah. And that's where I've kind of integrated musculoskeletal ultrasound quite a bit, is you can really see how the sliding surface mechanism works. And so, yeah, you might have pain down around the malleolus, but you see the movement restriction further up into the muscle belly, to your point.
That's something I'll definitely have to look into at some point. MSK ultrasound, I like it. So we've talked about the tendonitis type presentation. We've talked about the plantar fascia type presentation there. I know a lot of the runners especially will talk about like that medial tibial stress syndrome type thing, or, a lot of them will just refer to it as like a shin splint. Is it a similar type approach there with the CTM band, just kind of finding your main limitation and using that to address it? Or is there other uses for the band in relation to something like a overuse repetitive stress type injury?
Yeah, I mean, there's definitely use to it, especially with once that tendonitis or tendinopathy or tendinosis becomes chronic, we're wanting to increase blood flow as much as possible, so that the ischemic response to having a band wrapped around there, literally limiting blood flow for 3 to 5 minutes, that ischemic response can really trigger fresh flow of blood and oxygenated blood to get to the area. So it'll assist with warming it up. Say it's a medial tibial stress syndrome that you're training through, but you're just closely monitoring and managing and not letting it get to the level of a tear or stress reaction. Using something like the band or a similar tool for warm up can really jumpstart the process to get it where it needs to be to get through the workout or the run.
That just dives in further to kind of the physiological mechanism of what we do. I think a lot of times people think of something like, soft tissue release or trigger point release as more of like a biomechanical type construct, when in reality, as you just outlined, it can also have physiological effects that benefit injuries and improve tissue quality overall.
Mm-hmm. Yeah, absolutely.
And after the ankle, kind of the next thing as we work our way up the chain that comes to mind for me that I've used the band for is kind of that quad hamstring type area there. So when you're kind of thinking quad, hamstring, and application of the CTM band, Kyle, where does your head go? Do you think of a certain diagnosis or a certain presentation, or where do you typically use the CTM band with like quad, hamstring type stuff?
Yeah, so I mean, on the anterior surface, a lot of patellofemoral syndrome, a lot of runner's knee, patellar tendonitis, IT band alongside the stability work that's typically required to get an IT band better. But it's another one of those busy junctions of tissue that can very easily get junked up and lose that sliding surface mechanism. So above the kneecap, below the kneecap, it typically works pretty well. And then on the back too, in the hamstring, I had a runner, a hurdler last week, where the pain was more at the attachment of the semitendinosus on the back of the knee, but with palpation and assessment, it showed that there was some restriction, you know, much further up into the muscle belly and proximal end of it, to where, you know, that's where the work needed to be done to ease up the tension behind the knee.
You know, again, going back to the importance of assessment, you mentioned about using the band distal to the kneecap for the knee type, the tendonitis type presentation there. How would you go about putting the band right over, I'm assuming, the patellar tendon?
Yeah, so that's one where I've a bunch of videos and pictures of it too, but you typically would want to do like one or two knobs above the kneecap, get it real tight, and then just have the band part be below the kneecap. So you kind of you start above the kneecap, do a round or two above, and then leave some space for the actual kneecap, but then wrap it real tight underneath, kind of the same way you'd have a patellar strap on there with typical patellar tendonitis. And then that's one where you'd go through some lunges, quad stretches, just to get that kneecap going. Because especially if it's a runner's knee or chondromalacia, where the kneecap isn't tracking or gliding the way it should, the kneecap, along with, you know, the necessary stability training, if there is a tracking issue, can really help warm it up.
Yeah, that's interesting. And I guess I would say too, would you say that you have more, just based on your experience, do you have more benefit going distal to it, or would you say that proximal tends to work better, kind of hitting more of like a quad and kind of decreasing the quad pull or the quadriceps tightness, I'll say, on the kneecap?
Yeah, I think it depends. Like if it's patellofemoral primarily, patellofemoral syndrome, you definitely operate more proximal. But if it is that patellar tendonitis, where you're feeling it going up and down stairs, running downhill, that kind of thing, that's where you really do both of them, proximal and distal, above and below the kneecap.
I even like, as you were talking about the hamstrings there, you mentioned about how you kind of assessed, you know, the pain source was distal, but you assessed more proximally and found that working proximally gave you benefit to the distal area where the pain was. And that's why I bring up about the quad for the patellar tendon, is sometimes the pain location is not necessarily the pain source, I'll say.
Yeah. I mean, that 100%, especially for an athlete going through a repetitive motion. It's you note and fix where the pain is, of course, but then instantly looking above and below and trying to figure out, all right, where'd this come from?
Right. And you were saying about the use of something like the lunge progression as kind of your go-to for the CTM band when we're working with quad and hamstring. Is that correct?
Yeah. Just again, going through the progression and seeing what they can tolerate. You know, you might be a completely passive thing to start if you're a clinician putting it on, someone trying to get them warmed up and ready for competition. But if they're using it more as like a self-treatment tool, they might go through more of that progression where they're going through some squats, lunges, that kind of deal, jumping, and anything you want to get as functional as you can, as far as replicating the movement that we're trying to get better at.
Now, can you use this the band for your hip, or how would that work for like kind of hip muscle type area? I don't think I've ever used it personally for like any kind of like hip or gluteal type stuff. Have you ever used it for any of those sort of things?
I haven't. You know, the limitation for it is definitely that it's used more for extremities. I've had people tell me that they use it on their glutes, but I don't know how you could get it tight enough. That's where I would go back to probably the foam roller, because that's one where that's an area where you really can, put your entire body weight into the roller, and for the most part move the hip through the rotation that you need, whether it's a external or internal rotator or something along those lines.
I think it's important to kind of remind people, like, this is supposed to be a tight, compressive type feeling. Like, this is not going to feel the most comfortable, I would say. It's not necessarily the worst thing I've ever felt, but it's not necessarily the, feel good 20 minutes on the hot pack kind of treatment we're talking about here by any means.
Yeah, and that kind of goes back to it. The studies that have been done on myofascial release or similar show that you have to have, at least 2 or 3 minutes of deep sustained pressure before tissue starts to release. So you want it to hurt. But that's why I go back and forth between like having it listed and selling on Amazon, because I'm worried about the amount of people that'll buy it and and put it on and say, oh, this is awful, this hurts. But it might be more of a niche type thing for people who athletes and both clinicians who understand that you want to make it hurt if you're trying to cause a positive change in the tissue for the most part.
Yeah, definitely. Well, not only that, but just changing our conversation around pain. I think that if people come in with, say, like we'll just go with an easy example here, like a subacromial impingement, they typically complain of that sharp, pinchy type pain in the anterior aspect of the shoulder. Well, if they come in, 3 weeks later and they're saying that they're, it's a soreness type pain or a DOMS type pain, then to me, that's a lot better than the sharp, stabby initial type pain that brought them in.
Oh yeah.
So, I'm perfectly okay with someone coming in and saying, I don't feel 100%, but I don't have the same pain that caused me to first come and see you. I think that in general, we need to kind of find a way to change our conversation around pain. That's my quick sidebar.
Oh yeah, 100%. That's that. I give high fives when we get to that point. That's great. Especially for something like that anterior shoulder pain that gets so nasty.
Yeah, definitely. Now speaking of shoulder and just upper extremity in general, I know you've had a lot of success using the CTM for like a CTM band for like a lateral epicondylitis, lateral epicondylgia, can't talk all of a sudden, type presentation. Now for me, I'm not someone who treats a whole lot of, say, I'll say elbow, wrist, hand type stuff. So how would you go about using the CTM band for like a lateral epicondylitis, and what kind of movements would you look to incorporate there?
Yeah, so that's one where you want to get as functional as possible. So actually today in my office I had someone with lateral epicondylitis, and she was having a little bit of the sharp pain with any type of loaded wrist extension. And so we imaged it first with ultrasound to make sure there's no tears, and there wasn't any tearing, but it looked like there was a little bit of entrapment going on where some of the connective tissue between the extensors of the wrist, that it showed up on imaging as being almost like thickened or densified. It had more of like a whitish type of appearance compared to normal healthy tissue. And so that to me was a green light to start digging in. So we did the band using one knob. Since it was me applying it, we made sure that it was in the right spot and with her feedback, and then just took it through as much range of motion as possible, and then combined that with some Graston A-stem. We've done needling before, and she didn't respond real well to that, so focused more on the Graston and CTM band today, and it ended up making it a whole lot better.
Awesome. I'm sure it wasn't pleasant in the process, but it had a good result. Now you mentioned there as well about, making sure it's on the right spot. And as you mentioned before, that's just finding, the spot of the most tissue limitation. But in this case, with the, long-term changes as a result of the condition that you found on musculoskeletal ultrasound, you're looking more at the area that showed up on imaging as being abnormal, not necessarily the area that you palpated. Is that correct?
Yeah, I couldn't really tell a change for palpation, but the musculoskeletal ultrasound isn't an end all be all, like with this one today, but it is an important tool. Like today it was looking to see what looked abnormal, combined with also feedback, like, all right, where the probe is right now, this is where you feel your pain. And she said yes, and that's exactly where the spot was that looked like it was entrapped. So yeah, it's kind of a combination of a few things.
Outside of the tennis elbow, lateral epicondylitis type presentation, is there anything else you use it for up in the elbow or wrist or just arm in general?
Yeah, I mean, obviously for lateral epicondylitis, you use it for medial epicondylitis. Sometimes carpal tunnel type symptoms that is still treatable down closer to the wrist. Being in Kentucky, I treat a lot of jockeys, and so they'll have a lot of like wrist and hand pain. So we'll use it for that, just to kind of open up the structures of the wrist a little bit more, and that kind of deal.
How do you go about using it for the wrist and hand there? That's beyond me here.
Well, so that would be one where, say that, they have more of like a carpal tunnel type issue because they have their wrist in flexion a lot. So with palpation, if there is any spots that feel densified or kind of locked up, you can either use one knob of the band to dig into a spot if there is a piece of the muscle that's locked up, or that's where you could probably use it as just as like a straightforward floss band, where you take all the knobs off and just use it as like a compression tool to wrap real tight around the wrist.
Gotcha. That's interesting there. I don't see a whole lot of wrist and hand, unlike you, but it's definitely good to have tools in your toolbox to handle that and manage that as a clinician, because when you do see them, you have to be ready to do something. You don't want to be turning patients away because you don't know. I personally feel like I don't know is never an acceptable answer.
Yeah.
Now, taking that a step further, people might not always seek a clinician for use of the CTM band. They might try and kind of treat themselves, which, I think is I'll say a growing subfield of medicine right now, is people having the ability to diagnose and manage their own types of symptoms. So all of these things we've talked about today have kind of been in relation to a clinician assessing. Is there any insight or feedback that you would give the people who want to use the CTM band to kind of treat themselves, I'll say?
Yeah. And I mean, as you know, it's risky to the self-treatment thing. So yeah, I mean, it's tough because there's such a gamut of things someone might be dealing with. It honestly, I mean, the correct answer is to have it evaluated, right? For someone that by someone that you trust and can take care of it. But if it's if it's obviously not something that needs medical attention, say it's some straightforward calf tightness or ankle tightness while you're running, the band should be in that category of things that people are trying as a self-treatment. If they're not ready to go get the advice of a professional yet.
Or even like a DOMS type presentation, right? Like if someone's just got general soreness and achiness, I would imagine that using this could kind of help with the compressive side of it to increase circulation, kind of like you were talking about before with the medial tibial stress syndrome.
Yeah, and it's this one I think there's a little bit more of a learning curve with the band, because you are purposefully making it hurt. You're literally wrapping the band so tight that it's going to, for the greater good, limit circulation for a couple minutes at a time. So that's why, I try to be available at any time if someone has specific questions about how to use it. And I've, made a bunch of videos and, have PDF instruction manuals for how to use it. Just so people have as much information in front of them as possible.
Well, you even have a full Con Ed course for the band now too, correct?
Yeah. So I did an online certification course that clinicians have used, where I just kind of outline, what the band is, how it works, what the research is behind it, how to integrate it into either your clinic or at home or gym or wherever. And again, just as a means to give people as much information as possible and how to use the band to its full capabilities.
Right. And is there anyone that, shouldn't be looking into that course? Like, could a chiropractor take it, athletic trainer, PT, massage therapist, or personal trainer? Like, is that course for everyone, or?
Yeah, it's really for everyone you just outlined. It's for the medical provider. It could be a coach, athletic trainer, personal trainer, chiropractor, PT, massage therapist, anyone who's going to be, using the band for their clientele.
Awesome. We will definitely link to that below in the description so you can check that out there. Kyle, as we start to wrap up here, we've kind of touched on applying the CTM band for plantar fascia. We've touched on the ankle, the quad, the hamstring, and even the elbow and wrist. Is there any areas that we missed or anything that you feel like we didn't address in relation to applying and using the CTM band?
Yeah, did my part about the calf get cut off with the ultrasound using the pre and post?
Yeah, I would definitely say we should hit that again real quick.
Okay. Yeah. So after the plantar fascia, we're talking about how to use the band on the calf, and that's where I've really integrated the musculoskeletal ultrasound to observe, the before and after effects. And that's where I'd love to at some point launch some studies on how to measure that tissue, the tissue glide, because there really have been some cool changes that where but before we even touch the tissue, say it's like the lateral head, the gastroc, where it meets the soleus, and that's where a lot of a neutral gated runner, walker, athlete will have tightness and have trouble treating with some of the stretching and foam rolling, etc. So we've been able to look at the tissue pre-treatment, see the restriction and the glide, and then apply the band and do both passive and active range of motion exercises, and then observe the tissue afterwards via imaging and the ultrasound, and it shows distinct changes in how well the tissue is gliding. And that kind of goes back to the study I was mentioned before that showed, as an Achilles gets closer to tearing, a lot of times you can observe the decreasing sliding surface mechanism. So, that to me as a clinician, that's big to be able to prevent those types of major injuries if we can monitor and see positive results with imaging.
Yeah, definitely. And, the benefit to that is having all that information real time, right? You get a real time image, you get a real time result from your treatment, and you're not guessing, is it going to work? You literally know in the moment, hey, this is doing something. So I love that approach. And I love how, just simple use of the band is having such positive effects. Because as you said, we want to prevent as many injuries as we can. And while I'll say we never 100% get to the true root cause of an issue every time, we can certainly do things to identify abnormalities and address as many of them as we can. And having the ability to do that quickly and pretty much wherever you want to be, conveniently through something like a CTM band is certainly a powerful tool in the toolbox to have. Kyle, for people who want to check out the band or check out your clinic in Kentucky, or just kind of learn more about you, where can people find you at?
Yeah, so the band is the website is just ctm.band. And so that has information on if you want to order it or read more about it. And you can reach out to me anytime. My email address is kyle@ctm.band. And then for my clinic, again, it's called Kentucky Sports Clinic, and I'm in Louisville, Kentucky. So anytime I can help with anything, or if anyone has any questions that I can answer, definitely feel free to reach out.
Awesome. Yeah, we will link to all of that in this description below, so you can just click there and access all of that. Kyle, it's always a pleasure. Thanks for your time, man.
Thank you. Thanks so much for having me.
Thank you so much for listening to this episode of the Brawn Body Health and Fitness Podcast. If you liked this episode, please make sure to share it with a friend, subscribe so you don't miss any of our upcoming episodes, and leave a review. This way we can spread knowledge and motivation and help reach more people. Thank you again for listening, and I'll see you next time.